Hello folks, I'm Brent and I'm here to tell you about my first experience with cancer treatment. My cancer is follicular lymphoma, stage 3. I have two tumors, one that's the size of a softball and another that was the size of about a pecan, one in my chest and one in my groin area. They typically are with follicular or any kind of non-Hodgkin's lymphoma, one of the 200 plus lymph glands that you have in your body will start accumulating these mutated cells that are typically the cancer. So if you or a loved one have been diagnosed with lymphoma, my heart goes out to you. Any kind of cancer news is tough, whether you're a caregiver, a friend, a family member, or a patient. But you are a survivor. So see yourself as a fighter of this cancer, and you're going to beat it. You have a lot of things at your disposal. You have friends, you have support, and you have your doctor's team that are looking at your disease and sharing with you the different types of treatments. Fortunately, there's many treatments that are available with lymphoma. So I really wanted to share with you my experience though. So the first thing I wanted to share is I've gone through another treatment called Bendamustine Rituxan. It's 5 years ago when I was initially diagnosed with follicular, which oftentimes comes back. It was held in remission for about 5 years, and it came back last year. So they looked at another treatment, which I did, which was lenalidomide and obinutuzumab, 2 monoclonal antibodies that are not chemo. However, that was not successful. So now on my third treatment, still with a cancer that's still growing. So the doctors decided to put me on RCHOP. So RCHOP is something that I want to kind of share the rest of this first video about with you. I'm going to go through 3 parts. The first part is what it is, what RCHOP is, and the first day of infusion, kind of what to expect. The second part will be what to expect after your first infusion, the days right after the second week, the third week, until your next infusion. And then I'm going to share some of my personal recommendations. So these are some of my observations, and I wanted to, these are just my unique side effects. They may or may not happen to you. Notice that I still have my hair. This is the third week, going into the third week after my first infusion. So I'll hit on the big side effects. Everybody knows about those, I've heard. So the first thing I wanted to share is RCHOP stands for RCHOP. RCHOP. And the first drug is Rituxan. The last drug, R. The last drug, P, is Prednisone, which is a steroid. Those are what I call friendly chemo drugs. They're not really chemo. They're more there to biologically help you. The CHO are, those are the tough chemo drugs that kill anything that they encounter cell-wise. So I want to touch on first the Rituxan. It's called rituximab in the generic scientific form, but rituximab was a product that was designed, it's a mature product of about 15 to 20 years ago. They developed this by merging a human cell with a mouse cell. And they found that they could engineer these genes to attack certain cells that are laced with protein markers, so that when this drug went into your system, it knows to look for like the CD20 protein among some other CDs numbers, and it will target those genes like a hunter-seeker. So I view Rituxan as a hunter-seeker anti-cancer drug. It doesn't kill these good cells in your body. It only attacks those with those particular proteins, which is what you want. You don't want the drugs to go kill everything in your cell system, all your white blood cells and red blood cells. So Rituxan is your friend, I say. It's also the slice of bread on top. It's the R. On the bottom, there's the prednisone. Prednisone is a steroid, and it's there to help you as well. And it's there to make you feel better and to give your body a jolt of energy to be able to give you a boost in your ability to deal with some of these side effects. Because the middle part, the CHO of the RCHOP, is what I call the meat, and that is those are the tough chemo agents that just go out and they kill much more than just the damaged cells that are your mutated cancer cells. So let me touch on those. Got my paper here, but it's I'm not going to go into the details of these, but the CHO, most people, you just Google RCHOP and you'll see it's cyclophosphamide, it's doxorubicin, and vincristine. So those three drugs are given one after the other after they do their Rituxan. So there's really only 4 drugs in the first day when you go in to the infusion day. So let me go more into what to expect the first day. When you go in, take a backpack full of stuff that's going to keep you occupied. Sometimes it's very cold in there, so they usually have heated blankets, but wear something comfortable, multi-layered, and that you'll be able to sit within for about 6 to 8 hours. The infusion day is a full day typically, so don't tell people you're going to come back and go to work. Maybe you can answer some emails, but give yourself some grace the first day. You're going to be there. So I'll share more with you about my recommendations, but the first day is where you go through. My experience was my Rituxan was given first. You'll given a couple of drugs the first to start off. They'll give you an IV. They'll either go through your vein or through a port. A Mediport is what it's called. I have one. You see this little bulge, it's got 3 dots, it's a power port, and then you actually can see this thing that they slid in. The surgeon put it into one of my main arteries so that the chemo drugs can be mixed in a large artery instead of a small vein, because in some cases there could be damage with small veins if it's just IV. But both are administered with those types of methods. RCHOP is the first one that I had was Rituxan. They gave me a large dose of Benedryl. Benedryl, typically I have allergies, so I'll take Benedryl and it doesn't affect me. But the dosage they give you is very strong because there's known human reactions that occur when you get this drug, because it's a merging of the mouse cell and the human cell, and it can create an allergic reaction. Your body's kind of saying, what's up with this? And you'll start seeing some different allergic reactions. Typically, how you have reactions to things, foods, smells, dust, cat dander, you don't necessarily get a drippy nose, but for me, I got hives because the body, and I hardly ever get hives, but I have gotten those before. They had to then titrate down the Benadryl to a lower dosage, so it's a lower, slower drip, and your body can then initially start getting used to it. After the first time I had that 5 years ago, the second and third time it was no big deal. However, Benadryl does make you very tired. So don't expect to get a lot done. If you want to read a technical book, I'm in IT, so I'm sitting here, oh, I can study this, or I'll bring my laptop to do some work. You tend to get very drowsy and you're a little sleepy. And so you kind of rest your eyes, and before you know it, an hour you wake up and you're like, I'm sitting here, I just took a doze. I took a deep sleep. So expect that with Benadryl. After the Benadryl, then they'll start giving you these chemo drugs one at a time. They'll give you the C drug. They'll give you the O drug, and the O drug is the doxorubicin. It is a strong drug. It's the red devil. If you've heard of this, it's two big, gigantic, about the diameter of a quarter. They bring out two different like syringes, and they don't stick it into your arm in a needle form, but they inject it into your IV. And that red color, they call it the red devil because it's so red, and some people have seen it go through their veins that has been injected into their arm. I didn't see that with my port, but there are some weird stuff that the nurses will tell you, some side effects that can happen, but it's not that big of a deal. You may see red in your urine, which is alarming, but just know that that's the red devil coming out of you. Okay, so that's a good thing. Well, after the first day, and while you're going through each of these, you're given all these cocktails, right? One after the other. And I usually like to keep up with that, but I'm like, okay, I'll just let it go. I just take what you give me, lady. And she asked my birth of date. You might want to get used to that because that's going to be how they identify the right patient with the right drug, because you don't want the alternative happening. So once you are complete with your treatment, you're going to feel, okay, I'm going to go home and I'm going to try to feel, I'm going to get caught up with work, or I'm going to catch up on these errands. Just give yourself some grace and just go home, and it's kind of right off that first day. You can go home and check some emails, but let me tell you, you're going to be tired. Your body's going to start going through what I call this first week stage, which I call the initial shock. Your body is saying, what the hell? And so your body is going through a lot of cell slough off from the death of these cells that the chemo drugs are attacking. And it's attacking the tumor area primarily. You might feel some different pressure or stress around that area. In my case, it was my chest. You may feel it in different parts of your body, your back or your legs. But my major thing about my shock was my body just was like very fatigued, and I had a pressure in my chest where I think my tumor was. Some people, if they have it in their bowels, they have it in their stomach. I had headache. I was tired. And I immediately started feeling constipated. So I did not feel nauseous. They gave me some anti-nausea medication for their infusion, so sometimes that can occur. There's probably 20 different side effects, but the ones that hit me the most were the constipation, the fatigue, the pressure and stress in my chest area. Not enough to keep me from breathing, but it is definitely different. Like I had some kind of a sickness and a headache. And so you want to go to bed. You want to drink a lot of liquids that first day. Try to drink 8 to 10 glasses of water or Gatorade, or I use this alkaline water, or I'll use different types of Gatorade that taste good, or just good, just liquid. When you get home, you're going to start taking the prednisone, right? There's 5 pills per day. It's kind of weird, but you got to read the instructions that it's 5 pills per day for 5 days. So you get five tablets that you want to take that night. And in fact, you may want to bring those with you in the infusion room. I didn't. The nurse asked me, did you take these before the infusion? Because they want you to kind of have that in your system. I didn't. I waited until that evening. If I had to do it all over again, I would probably start taking them that morning before I go in, because they start kicking in and they help your body. Now, the last thing about prednisone is that it's been known to make people wired, stir crazy, like think of it like you've drank 10 cups of coffee and you're kind of antsy. I didn't really feel that way. Everybody's different. If you're very sensitive to different drugs and you've never taken a steroid, you may want to ask your nurse about that, if taking the full dose or half a dose in the morning and a half a dose in the evening. But they're a good thing. You do not want to stop taking those until you run out on the 5th day. They make your body help you endure this. Last thing, after the 5th day, you're done. On the 6th day, we kind of entered into the full bore second phase, right? The second week. And that's what I call the full storm. You really start feeling the major brunt of the weight of the cancer killing drugs in your body. The cells, it's going after the cells in your body, and it's attacking the cancer. Your body, as a result, is going to feel it's in a battleground, right? It's going through stress, and so you're going to end up feeling fatigue. You're going to end up feeling even more fatigue than you did the first 5 days, because the prednisone's gone now, and now it's just you and your body in the aftermath of this storm. I immediately had since constipation, I mentioned constipation was my major thing in the first couple of days with the prednisone, but it wasn't because of the prednisone. I think it was because of the chemo. Just continue to take Neulasta or Metamucil just to keep your bowels lubricated. So you don't want those to become dry or hard, and so that's not a good thing. If you have the opposite, diarrhea, talk to your doctor about the best medication for that. But I ended up buying Neulasta and Metamucil and taking that in the first week. The second week, I did not have constipation. I had fatigue. I still had body pains. And day 14 through 21, which I'm in now, it's really I had some fatigue, but probably the days from 18 to 21, you feel kind of normal, because the first wave of the medication has gone through your body, and your body has excreted all those old dead cells through your body waste, and so your body is kind of getting back to normal. So the last phase is what I call after the storm. It's the sun's coming out, you're feeling a little bit better, but now guess what? There's a storm coming, because you got the second one coming in. So stay tuned for that. I will go through the second chemo session. It's called the second cycle. So a couple of things real quick about the last thing. The last thing is my recommendations. You will be given, probably with RCHOP, a shot of Neulasta. Neulasta is not part of RCHOP, but it's designed to help boost your white blood cell. Your white blood cell. The red blood cell is not really affected by Neulasta. It's a costly drug that needs to be pre-authorized, so I'd recommend that you ensure that your provider has put in a prescription for a pre-authorization of this drug. It's expensive, $3,000 to $5,000 per shot, and they typically inject it into the IV just like you're doing. If you don't have pre-authorization, they can't give it to you. And so what do? Well, that's what happened to me. Last time I had it 2 weeks ago, the doctors finally was able to get it pre-authorized, so they give it as an injection. So whenever you get your Neulasta, it's at the first injection or a week after is what they recommend. Let me just tell you, 7 days after Neulasta, you're going to go through a flu-like season of body aches deep in your pelvic area, because it's busy. Your body is busy making these these white blood cells and red blood cells. So what's going to happen is that you're going to start feeling the after effects of that, but they wane about after 7 days. I took the Claritin, which is very helpful for that. So that's a recommendation. And make sure to have Neulasta in your regimen plan because it helps you get back healthy, especially right now. I'm not vaccinated with COVID because I had never had a window to be able to do that with treatment. I'll address that later if there's interest in another video. So lastly, my recommendation is to be kind to yourself during this time. Be kind to others and your loved ones and friends. They want to know about you. Have patience with them. If you don't feel like talking, that's fine. Just be kind to yourself. Drink a lot of liquids, especially the first couple of days after your treatment. Keep drinking. Keep that hydrating going in your body. It's helpful. Keep electrolytes to replace what's gone. Take frequent breaks. If you need to, take a short nap, lay down. It will help strengthen your body to get through this time. Work if you can from home. I'll talk more about how to keep busy and do stuff later in another video. Also try to stay isolated after the 7 days of your first Neulasta shot, because what's happening, or after your infusion, because what's happening is that you're most susceptible in a couple of days after, I feel, of your in chemo, because it's reduced your white blood count and your red blood count. That's why the doctors are always taking, your vitals to see if everything is in line. You don't want to get to a point where it's so low that you have to postpone treatment, or will be susceptible to the Delta variant or any other variant of COVID. Keep to your schedule, listen to your body, and seek God for consolation in these dark times. You're not alone. You have friends. Reach out to friends that are trustworthy. Other people have gone through this.